They will give you a brief update and answer your questions. First, let's give the floor to Han Qingyan. Dear friends from media, good afternoon. The Omicron epidemic in Tianjin is still ongoing. The situation is still serious, and we have guidance teams from the National Health Commission right now in Tianjin. And now let me update you about the latest with respect to the epidemic. As of January 12th, we have reported 137 cases, among which 76 are local cases, in which there are 50 mild cases and 26 ordinary cases. And we also have 17 asymptomatic cases, 44 cases are to be further confirmed. In terms of geological distribution, the situation is similar to yesterday, and we have 130 cases in Jinnan District, 3 cases in Xiqing District, 3 in Hexi District, and 1 case in Binhai New area. Asymptomatic cases have not been listed as confirmed cases so far. We have also identified 5 cases from the citywide nucleic acid testing campaign. We have basically identified the transmission relationships between different cases, and later Director Zhang Ying will give you a detailed report. And now, let me brief you about some characteristics of epidemiologic surveys. And we are currently conducting epidemiological surveys. We have covered 107 cases, and this includes the detailed travel history of them. First, regarding the distribution of the 117 cases, we have 42 male cases and 55 female cases. The oldest is 47 years old, and the youngest is 5 years old. And this is basically the situation of yesterday. And the median age is 30 years old. In terms of occupation, most of those confirmed cases are students. There are 48 students confirmed. We have 6 retirees, and we also have confirmed cases that are unemployed. In those 107 cases, the earliest confirmed case is December 29, 2021. So at the very beginning, it was quite sporadic. Starting from January the 4th, the cases started to pick up. And starting from January the 8th, we have witnessed more cases, and we have 100 cases in Jinnan, accounting for more than 90%. There are 3 cases in Xiqing and Hexi District, respectively, and 1 case in Binhai New area. We have towns, for example, Xinzhuang, Jianshui-Wu, Beizhakou, Wangguanzhuang. They each have more than 20 cases, and in addition, apart from Jinnanzhuang, all the other towns, they are located in Jinnan District. Those who have more than 2 cases, for example, we have a primary school, we have Gaozhuang School, we have a jewelry training class, and a international hotel. So this is the geological distribution of these cases. How we identified them? Among these 107 cases, 1 was identified in hospital, 55 cases were identified through contact tracing. 5 cases were identified in nucleic acid testing campaign. And regarding vaccination, in those cases, 103 of them have been fully vaccinated, and that is triple vaccinated. 3 cases have been vaccinated for just 1 dose. So, as everybody is very concerned about the citywide NAT, and let me report to you that the first round of NAT initiated in January the 9th, and as of 12 o'clock today, we have covered 12.52 million people in our NAT campaign. We have identified 77 confirmed cases, and that includes the confirmed cases in controlled areas in Tianjin. As I said, that the other confirmed cases, they were identified in through contact tracing and through other means. The second round of NAT studied from January the 12th from 12 o'clock, and we have already covered 2.33 million people. The testing is currently going on, and we will keep you posted about the latest results. So this is a brief update about the NAT, and last but not least, I would like to tell the general public that we will disclose the travel history of the confirmed cases with the purpose to inform the public about our epidemiological efforts, and also if any one of you identifies a potential danger, if you have a contact or close contact with those confirmed cases, you are kindly reminded to work with us. And through our epidemiologic surveys, and we have confirmed some major high-risk venues. So that is why we have immediately engaged in some region-level control measures. And let me disclose those risk areas. In Hexi District, we have Dongfang Fuhao Grand Hotel. We also have a jewelry shop in Hexi District. And those who have been to those two places over the past few days must report the situation to us. In Xiqing District, we have another high-risk area, and those of you who have been to these places must kindly report the situation to various authorities and cooperate in terms of nucleic acid tests and isolation measures. Here I would like to remind the general public again that you need to pay close attention to the travel history published by the health authorities in Tianjin. If you ever encounter a case where you have potential contact or close contact with those confirmed cases, you have to immediately work together with us. And in case you have some symptoms such as a dry cough and fever, you will need to report the situation immediately to your local authority. So this is all from me. Thank you very much. And thank you very much. Ms. Han, may I now give the floor to Sun Zhiliang, and Mr. Sun will brief you on epidemic control on campus. Good afternoon, dear friends from media. On January the 8th, after the breakout of the epidemic, the Municipal Health Education Bureau immediately followed through relevant deployments and decisions. We have taken swift measures in controlling and preventing the epidemic in campuses. Number one, we have initiated the emergency mechanism. Immediately after the breakout of the epidemic, we held special meetings at the educational department. We made uniform deployment, requesting different districts and different schools to take resolute measures in handling the epidemic. Within the educational system, multiple meetings have been organized, and we call on all stakeholders to engage in a flattened management. And different educational bureaus at different districts must establish a joint control mechanism with different schools and with the schools within their jurisdiction, higher education institutions, colleges, primary and middle schools must immediately establish those measures on their campus. And number two, we elevated epidemic control at campus. And we need to focus on two major areas. Number one, immediately put in place control measures in our teaching activities. On January the 8th, we released an emergent notices requesting all the training organizations, educational institutions to suspend all types of offline educational activities. And also on January the 9th, we decided to suspend any form of offline activities of any form of schools or teaching organizations. And those activities must be suspended until new semester begins next spring. On the afternoon of January the 8th, we immediately suspended the interviews for teachers at different locations. And at 24 o'clock on that day, we made the decision to cancel all the interviews for teaching qualifications at different districts in the city. Another measure we have taken is today, which is January the 12th, we made it very clear that all the schools in Tianjin are released for winter holiday. Another very important measure we have taken is to put in place closed management at all the schools. And personnel not associated with the school are not allowed to enter the campus. Those who enter the campus must have their travel history reviewed, and they must have their temperature taken and also scan the QR code. We do not allow people get together at campuses. We also request different stakeholders to establish a reporting system. For schools within those three districts, in addition to those measures I've just mentioned, they have to work closely together with health authorities and public security authorities to engage in some emergency treatments and also in epidemiological surveys and contact tracing. Third, we have to put in place strict measures for school management. Most of the schools have been released so far, and because Omicron is very transmissible and it's very covert, so the educational bureaus in Tianjin requested an immediate contact tracing amongst students and teachers who were released from schools since December 23rd last year. And they have to conduct a daily reporting to their respective authorities and also report their health status on a daily basis. And those teachers and students who left Tianjin on December 23rd, they have to report the situation to their local jurisdictions and also conduct a nucleic acid test and report the results to their school authorities as well as jurisdictions. In order to put this practice on ground, the Educational Bureau has established a mechanism of 2-hour report, which means that within every 2 hours, the situation must be reported. And we also arranged leading government officials to press different schools to advance this very important campaign. And these practices and measures must be put on ground 100%. They must report the situation of leaving Tianjin or since December 23rd to their local jurisdictions and also to their school authorities. To our current knowledge, we have so far confirmed 320,000 people, schools, and that means that teachers or students who have left Tianjin since December 23rd. and most of those are students. And 97.7% of those have so far conducted a nucleic acid test. And more than 7,900 teachers have conducted a nucleic acid test. And so far, we still have hundreds of them who have not completed the nucleic acid test. Some have been put under home quarantine, and the remaining 774 people, they are currently awaiting a nucleic acid testing. And those who are staying in Tianjin for the summer holiday, they are not allowed to leave Tianjin unless it's quite necessary. In the meantime, we are conducting the contact tracing mechanism, and each and every person is closely managed with a personal file. And going forward, we will continue following the situation, improving our systems, and we will accelerate our efforts and make sure that all the different epidemic control measures are put on ground. So this is all from me. Thank you very much. Thank you very much, Mr. Sun Zhiliang. May I now give the floor to Madam Chen Yanhui, and for her to give you an update about the situation in Jinnan District. Dear friends from media, good afternoon. Since the breakout of epidemic in January 8th, Jinnan District has followed through the decisions and deployment made by Tianjin municipal government. And we have consolidated different measures on COVID so as to stop the spread of the disease to other places. And now I would like to report to you on the following details. Number one, we have engaged in a district-wide NAT, well, leaving no one behind, and we have established 313 NAT venues. We have covered 1.3 million people in our NAT campaign. The first round of NAT has completed, and we are currently in the process of the second round of NAT. Number two, we are doing a very good job in isolated management, and we have adjusted the scope of controlled areas and strictly controlled areas, and we are practicing all the COVID-19 measures so as to spread the outward transmission of the disease. And so far, we have dispatched more than 1,000 policemen who have blocked more than 286 roads. 212 of those roadblocks are within the district. More than 190,000 people are under health observation at their homes. Number three, ensuring the daily supply of different households. We have contacted different suppliers and enterprises leveraging the Wumei supermarket platform. We are establishing immediate and emergency supply sites at different control areas, and we are also closely monitoring the price of different daily necessities and supplies. We are very resolute in terms of cracking down on speculation activities. And we also have a service hotline, which is a 12315. This can answer people's calls and respond to their needs in case they have some emergency situations such as pregnancy or childbirth. For Nankai University and Tianjin University, where there are more than 20,000 students who are still staying at campus, we are monitoring the data. We are conducting a nucleic acid test so as to ensure orderly operation of the universities. In the meantime, we are collecting donations and support from the public, and we have mobilized epidemic control supplies and daily necessities worth of 810,000 yuan. We also mobilized more than 610 beds for those isolation centers going forward. We will continue following through the important decisions and deployment made at the municipal level. We will do a better job in NAT. We'll consolidate those isolation measures so as to earnestly contain the spread of the disease. Thank you. Thank you, Madam Chen. May I now give the floor to Madam Zhang Ying and for her to give you a update. Thank you very much. Now let me report to you the general situation of COVID in Tianjin. We are now into the 5th day of the epidemic in Tianjin. Everybody is quite concerned about the situation, but in general, if you look at the curve of the epidemic, most of the confirmed cases they identified on January the 8th, 9th, and 10th. In those 3 days, we have registered the most cases, and this is a pulmonary disease. This is a respiratory disease, and there is a peak, and also there is this very stabilized line, and this is quite rare, and this is an attestament to the very immediate and effective measures taken by Tianjin. And this shows that if we could be able to put on ground effective measures in the next few days, then we will ensure a very effective control. But we have to analyze the situation further and why and how come most of the cases registered on January the 8th, 9th, and 10th. According to our knowledge, the virus existed during the New Year's Day holiday. We are closely monitoring the situation of different training classes, and during the New Year's Day holiday, and those training classes, they did not let go of their students, and maybe they got infected in the New Year holiday, and when schools reopened, and they brought the case back to their own class and to their own schools, infecting more and more classmates. And after infected, those students brought back the disease to their homes. Those homes, they were distributed in different residential communities. And if you look at this transmission chain, you will understand why that we got so many cases on January the 8th, and why we were able to immediately locate all those cases, and why we could have so many cases between January the 8th and January the 10th. So there is a concern among the public that maybe the cases will pick up in the next few days. But according to our evaluation, the cases that we identified between January the 8th and January the 10th is the result of early massive transmission among the population. But we were able to immediately identify the transmission. But going forward, we can expect some transmissions, but it will be not in such a scale. People will not get together as they did before January the 8th. So that is to say, if we could put in place different control measures, we are confident in controlling the spread of the disease. And this being said, we cannot slacken our efforts. And recently, we have identified 10 cases that are isolated, not related to the transmission or infection chains that we have identified. What does this tell us? And this tells us that we are not doing a fully reliable job in contact tracing, and there is still the risk of community level infection. So that is why we are initiating the second round of citywide nucleic acid test. So exactly because of this, I would like to offer 2 reminders. Number 1, I hope all of you can cooperate in this citywide nucleic acid testing, as the risk is still there, so we have to cooperate with the municipal authority in this nucleic acid testing, and we have to conduct this in an orderly fashion. Which district goes first, which groups of people go first in this nucleic acid testing. So we need to follow the orders. If everybody reserves for nucleic acid testing, it will lead to people gathering, and this is not conducive to epidemic control. And we cannot allow, or we cannot afford another round of major infections because of the nucleic acid testing campaign. Number two, do not miss this nucleic acid test. If it's physically inconvenient for you to travel to the NAT site, you can report a citizen to your community authority, and different residential communities will make plans. For example, bring the NAT to your doorsteps, or they can dispatch vehicles to transport you to a nearby nucleic acid testing site. So it's not acceptable for anyone to escape the nucleic acid testing because it's physically inconvenient for them. So another reminder I would like to offer to the public is, as we have just heard those high-risk areas by Director Han, so we have to refrain from traveling into those high-risk areas. If you have traveled to those high-risk areas, contact the local authority in the first place. And also, on a daily basis, we are publishing the travel history information of those confirmed cases. If there is an overlapping between your travel history and those of the confirmed cases, you have to immediately report the citizen to health authorities, and then we will immediately pitch in and investigate the situation. So the purpose is to keep you off the risk. So that's all from me. Thank you very much. So now the floor is open for questions. I'm with Tianjin News, and my question is to Director Sun Zhiliang. We still have some students staying at universities and schools. What kind of service can we provide to them in these special times? Thank you very much for your question. According to the COVID-19 measures, we are providing all necessary services for those students, and we still have some of them staying at schools, and there are more than 52,000 of them in more than 12 universities. The municipal health and education authorities pay close attention to this issue, and we try to provide sound conditions for all of them. Number one, support their life. We are working closely together with different jurisdictions to provide support for their daily life. We press the university cafeteria to stabilize the price during this winter holiday so that all the students are fed well and fed in a safe manner. And we also look at barber services and e-commerce services within those campuses. Number two, academic support. So university campus is the place for people to learn knowledge. And we have to ensure a smooth internet connection so that students can obtain knowledge and continue with their learning through QQ and WeChat and other online platforms. Number three, we call on different universities to put up activities online, and this means cultural and sports activities online. Another very important job is to provide mental support to those students, and we have established a 24-hour mental service line. So in so doing, we are engaging in a very comprehensive and scientific set of means and measures to provide the best support for those students. We call on all the students to continue with their working out at their dorms, also on a playground, and we provide them with all types of mental support. And this will help enrich their life during the winter holiday. So this is all from me. Thank you. Next question, please. I'm with China Media Group. So my question is, as we know that there are 2 confirmed cases in Dalian who are believed to have come from Tianjin. So what is your comment on this? Thank you very much for your question. Earlier in the morning today, we got a joint investigation letter from Dalian claiming that 2 cases are presumably associated with Tianjin. And so immediately after receiving this information, we contacted Beijing and Hebei province. We reported the situation to both localities, so they have to contact the population and identify students or teachers or faculty members who have left this school. And those students who have left this particular school, they have to immediately conduct a nucleic acid test. Let's hope that the disease do not get infected, do not get transmitted to Hebei or Tianjin. So we worked with the educational bureau, and we provided a professional type of advice, and that is all the faculty members, students who are still staying in Tianjin in their university, they have to conduct this nucleic acid testing, and the result must be feedback to the university immediately. And we also need to ensure that this is a full covering comprehensive NAT. If any one of them have missed the first round of NAT, they must immediately participate in the second round of nucleic acid testing. We have some students and faculty members who have left Tianjin and returned home for this holiday, and the schools are responsible for contacting them and telling them to conduct a NAT locally, and the result must be sent back to the universities as well as to their local authorities as well as the Tianjin Municipal Authority. So these are the measures that we plan to put in place. So we do so to stop the disease from transmitting to a larger audience, because Omicron is truly very transmissible and it's very covert. As I have introduced earlier, a lot of the confirmed cases, they are asymptomatic. If they don't cooperate in telling us, we won't know. So that is why we call on the faculty members and students from Haijiaoyuan or Haijiao Park in Tianjin to work closely together with us. Should you report any symptoms or show any abnormal NAT results, you have to immediately contact the local authorities. We have so far conducted the second round of NAT. We have the National Epidemiological Control Team that is currently deployed in Tianjin. So we are very strict in terms of handling the situation. And we have teams from the national level, from the municipal level, and also from the district level. And we're also working together with the Educational Bureau and Public Security Bureau. And we hope that we can put together all the different forces so as to identify potential population groups in risk. And whenever we found a risk area, we will immediately close that venue and protect the public from the disease. So due to time constraint, this is all the Q&A session. So thank you very much. And this is the end of today's press release. Thank you.